Stress is one of the most overlooked cardiac risk factors. Most people think heart health comes down to a few numbers: cholesterol, blood pressure, maybe blood sugar. And yes, those do matter. But after years of practicing internal and functional medicine and seeing how often people are surprised by heart attacks, strokes, or other serious health events, I can tell you this: the warning signs are almost always there long before your symptoms appear. Some of the people who concern me the most are the ones whose numbers look fine, because heart disease rarely starts with abnormal labs. It usually starts quietly. And one of the most overlooked drivers I see years before a cardiac event is chronic stress. It's not just a bad day or a stressful week. I'm talking about the kind of stress that becomes your baseline. The kind you don't even notice anymore because it feels like normal life. From a medical standpoint, stress is not just emotional. It's biological. When the body perceives stress, emotional, psychological, or physical, the nervous system activates in a fight or flight response. This response is designed to protect us in short-term emergencies. The heart rate goes up, the blood pressure rises, glucose is released in the bloodstream, inflammation temporarily increases, and then ideally the system's supposed to shut off. The problem is that for many people today, it never does. I see this constantly in my practice. People managing demanding careers, caring for aging parents, raising families, constantly running around, carrying financial pressure, living through grief or loss, feeling constantly on. They'll often say, "I'm just busy, this is normal, everyone feels this way." But your body doesn't evaluate stress the way your mind does. Your body only knows one thing: am I safe enough to rest? When stress becomes chronic, cortisol and adrenaline remain elevated. And over time, that places real strain on your heart and blood vessels. Now, this part is critical. Chronic stress affects the heart in multiple overlapping ways. First, it keeps your heart rate and blood pressure elevated longer than it should be. Your heart is working harder than necessary day after day. Second, stress drives inflammation inside the blood vessels, damaging that delicate lining of the arteries. This is where plaque stores and becomes more unstable. It's not just more likely to form, but also become more unstable. Third, stress disrupts blood sugar regulation, leading to insulin resistance, even in people without diabetes. And fourth, stress alters longevity hormones like your estrogen, progesterone, testosterone, thyroid hormones, and cortisol. And finally, stress interferes with sleep and recovery. This is when the heart is supposed to be repairing. All of this can be happening even when cholesterol numbers look normal, because stress gets overlooked because it doesn't show up early on standard lab tests. Stress is culturally normalized, patients minimize it, and medicine hasn't even been trained to prioritize it in our training. Most symptoms are designed to react to stress, not recognize early dysfunction. So people are told, your labs are normal, come back if something changes, it's just part of life, just relax. What does it even really mean? Does that really resolve anything or truly make you feel better? But I can tell you that your heart disease doesn't start the day of a heart attack. It often starts 10 to 20 years earlier with subtle psychological and physiological strain. And chronic stress is one of the earliest contributors that I see. Normal cholesterol does not equal low risk. Stress can drive cardiac strain independently, especially when layered on top of hormone changes, inflammation, poor sleep, and metabolic shifts. This is why some people do everything right and still feel unwell, or end up with heart disease later. And if it's you, and if you've been eating well, exercising, taking care of yourself, but still feel tense, wired, exhausted, or uneasy, you are not overreacting. I do want to talk briefly about what actually helps, because addressing stress is not about telling people just to relax. When I work with patients, I look at stress on 3 clinical levels. First, the nervous system. Is it safety? The nervous system has to feel safe before the heart can heal. This often starts with sleep, light exposure in the morning, gentle breathing that slows the heart rate, and not forcing meditation or perfection. Second is physiologic stress load. Sometimes stress isn't emotional, it's metabolic or hormonal from the inside. Blood sugar swings, inflammation, overtraining, poor recovery, and hormone imbalance all keep the body in survival mode. Third, thoughtful supports when appropriate. This might include targeted supplements, correcting nutrient deficiencies, hormonal support, or medications when indicated. Stress management is not one size fits all. It has to be personalized. This is why stress deserves medical attention, not dismissal. The good news is this: when stress is addressed compassionately and medically, not minimized, the heart often responds in meaningful ways. That doesn't mean eliminating stress completely. It means helping the nervous system spend more time in regulation and recovery. Because calm is not a weakness, calm is protective. When the nervous system is supported, inflammation decreases, blood pressure stabilizes, sleep improves, hormones rebalance, and the heart becomes more resilient. Heart health isn't just about what we measure, it's about how supported your body feels. This is why I believe stress should be taken seriously, not as a lifestyle footnote, but as a true cardiac risk. True heart protection requires more than managing numbers on blood work. It requires looking at the whole person. If this resonates with you, and you felt unheard or dismissed when it comes to stress or your health, I want you to know there is another way to approach this, and there is still time to change the trajectory. Please don't let your first symptom be your last. This is about living smarter, stronger, longer. I'll see you in the next video.